Hello friends, I'm Jyoti Hikar and today I'm going to talk about the minimum criteria for reporting. So let's start. Firstly, we see what is adverse event for reporting. So the adverse event is any untoward, unfavorable medical occurrence in a patient or clinical investigation subjects administered of pharmaceutical products and which does not necessarily a causal relationship with the treatment as per ICH E2B guideline. So what is adverse event? Adverse event is any untoward, unfavorable, unintended sign. It included an abnormal laboratory findings, then symptoms and diseases, then unwanted effects. In unwanted effects, there are some symptoms like headache, nausea, then physical findings like BP, lump, edema, or abnormal lab values like increased liver enzymes and decreased hemoglobin, etc. Then overdose important to define what percent cutoff to be taken as adverse event. Then we see the example. In example, the unfavorable deviation from the baseline health, which includes the headache present at a baseline was mild, moderate, and maybe become severe. Then worsening of a condition present at the onset of the study. Then unfavorable deviation from the baseline health, which includes the patient deterioration due to primary disease. Then BPH study, the patient going into the acute retention of a urine. Then antibiotic studies, in this the URTI progression to a lower respiratory tract infection. Then the next examples is due to a concomitant medication, the adverse event caused. Then due to the hypertension trial, then PT become with the diarrhea. Then interrogation had taken antibiotics and because of URTI also. Then adverse drug reaction. What is adverse drug reaction? In pre-approval clinical experience, defined all nauseous and unintended or unfavorable response to a medicinal product related to any dosage should be considered as an adverse drug reaction. The phrases response to a medical product means that a causal relationship between a medicinal product and an adverse event is at least a reasonable possibility. For example, the relationship cannot be ruled out. Then unexpected adverse drug reactions are included. An adverse reaction, the nature of severity which is not consistent with the applicable product information. For example, the investigation brochure for unapproved investigational medicinal products. Then a serious adverse reaction. In serious adverse reaction are defined as any untoward medicinal occurrence at any dose. It results in a death. It causes a life-threatening. Then it requires the inpatient hospitalization or a prolongation of hospitalization. Then result in persistent or a significant disability, congenital anomaly or a birth defect. Then we see the suspected unexpected serious adverse event, also known as SUSAR. The serious unexpected adverse drug reaction is one the nature or severity of which is not consistent with the information in a relevant source document. Then it is a seriousness, intensity, then a relationship to a drug, then expectedness, and also the unexpectedness. Then we go forward to our next point. It's a life threatening. The life threatening means any adverse event that places the patient or subject in the view of the investigators at immediate risk of a death from the reaction as it is occurred. Dose does not include the reaction that had it occurred more severe form might have caused a death. For examples, the pacemaker failure, then gastrointestinal hemorrhage, infusion pump failure, then toxic drugs levels also. Then we see the severity of adverse event are classified according to WHO in three types, that is mild, moderate, and severe. So the examples of this adverse events severity is like a dizziness. Patient feels like symptoms but cannot go with their routine activities. Non-serious adverse event with a mild intensity, then myocardial infarction. Then we see the reporting frames. First is a serious unexpected or life threatening unexpected adverse reaction. Then in that we see the our next point is minimum criteria for reporting. For regulatory purposes, initial reports should be submitted within the prescribed time as long as following minimum criteria as met. Then in which the first is identifiable patient, suspected medicinal product, identifiable reporting source, then event or outcome that can be identified as a serious and unexpected. There is a reasonable suspected causal relationship. Follow-up information should be actively sought and submitted as it become available. It's all about the minimum criteria for reporting an adverse event. Thank you.